Vitamin D is a non-negotiable for our health and well-being at any age, but never more so than in midlife and for us moving into menopause stage of our lives. It is the most researched and studied vitamin over the last years, and there's been more tests done on vitamin D than all the other vitamins put together. It's estimated that around 25% of adults in the UK don't get enough vitamin D, and those more at risk are people with indoor jobs or over 65 years of age, as older skin makes less vitamin D. Vitamin D is sometimes known as the sunshine vitamin because we actually manufacture the hormone in our bodies, but we need a stimulant, which usually comes from UVB radiation or sunshine, and hence the name that it has been given. Once we have the sunshine, then we need to synthesize vitamin D in our bodies. However, when this happens, it'll only last for about 60 days because we use it up very quickly. It is absolutely vital for absorption of calcium to give our bones strength and hardness. And during the menopause and perimenopause, the lack of estrogen weakens the bones and can increase the risk of osteoporosis. So vitamin D works to slow down and also to minimize this process. So it is one of my top vitamins and supplements that I take, as well as magnesium. The two of those are my two go-to ones all the time. So what are the health benefits of taking your vitamin D? Number one, it's going to support your immune system. Number two, it protects us against coughs, colds and sneezes, and especially in the winter months. Come September, October time, when we lose the sun, our vitamin levels reduce, which is one of the reasons why we do get more colds and flus in the winter time. We don't see these as much in the summertime, but viruses don't go away. They're always about. So it's partly down to the body just not getting enough vitamin D because there's less daylight and we're not producing it internally. We're not producing it within our bodies. Vitamin D also helps your body absorb calcium, which gives bones their strength and hardness. And recent research has shown that vitamin D may also play an important role in regulating mood and warding off anxiety and depression. It can help with those who suffer from seasonal affective disorder, SAD. Studies show the connection between mental health and winter blues and lack of vitamin D. So taking the supplements can make a huge difference to your mood, and it's maybe something that you actually haven't thought about how a vitamin will make a difference to us. So we all know how much better we feel when we go away on holidays. We're aware that our form is better, our mood is better, and we're more uplifted. So we need to maintain that in our winter months as well. And this is another good reason, if you can fit in a little winter break, a little holiday to the sunshine in the winter months, then please do so. Other studies have shown that people with low levels of vitamin D have a higher risk of developing type 2 diabetes. So the supplementation may help lower blood sugar levels with type 2 diabetes and reduce the chance of pre-diabetes developing into full diabetes. So another interesting fact and good reason to maybe think about increasing this wonderful vitamin. So deficiency. If you are deficient in vitamin D, what are the symptoms that you could be feeling right now? So one of the things is bone density reduction. Women can lose up to 25% of their bone density once they go through the menopause. Your bone density actually starts to decrease in your 30s, but this will make your bones weaker, less pliable, and therefore more susceptible to breaking. Aching bones. If you have any aching bones, it can be one of the first symptoms of vitamin D deficiency. So think of the cold weather, people with arthritis and joint problems. They're always saying, oh, it's the cold weather. It's not, it's actually our reduction of vitamin D, or it can be the reduction of vitamin D. It also affects, as we've said, our low mood, can be implemented into seasonal affective disorder, tiredness, and just general back pain and muscle pain. If your aches and pains, again, magnesium and vitamin D can be very beneficial. So how are you going to get it? Number one, the first one really is through exposure to the sun. Experts say 10 to 30 minutes sun exposure at least twice a week between 10 a.m. and 4 p.m. to the face, hands, arms and legs without using a sunscreen. You can think even with women's moisturisers now, we have an SPF of 30, and makeup usually has a sun protection factor as well. So it can be more difficult as we're usually only averaging about 5%, exposing 5% of our body to the sun. The second way you can do it is through a supplement. The recommended daily allowance was actually first set in 1947, and it hasn't moved much from those days. And back then, people didn't really know an awful lot about vitamin D. They measured the amount of vitamin D in a 5 spoonful of cod liver oil, which was seen to ward off rickets, and the recommended dose was 200 IU. Nowadays, the dose varies, and it's recommended to base it on your body size and weight. The recommended dose now is 1000 IU per 25 kilogram of body weight, is the rough guideline and estimate. So if you're 75 kg in weight, that's about a 3000 IU maintenance dose, which is a good rule of thumb to go by. Most multivitamins and minerals only have about 400 IU of vitamin D included in them. So you can usually top up with another supplement just for better health and well-being. And another thing you can do, you can elevate your levels over a month or so and then go back down onto a maintenance level. And of course, like everything, you can ask your doctor for a blood test to check and to see what your vitamin D levels actually are. The third way you can increase vitamin D is through your diet. However, this is definitely a lot more challenging. Best sources are oily fish like salmons, sardines, mackerel, red meat, liver, egg yolks. If you're vegan, try with soya and almond milk and yogurt. Some orange juices are fortified with vitamin D. However, dietary sources generally don't give you the quantities that a supplement would give you. My own personal choice, and the one that I've been using for quite some time now, is this little one. It's the Better You Vitamin D Oral Spray, which is an optimum strength vitamin D supplement specially formulated to deliver vitamin D through the soft tissue in the mouth for optimal absorption. Each spray delivers 3000 IU of vitamin D, which is correct, more or less correct for my body weight. And I prefer this. It's a convenient alternative to tablets and capsules. There's 100 doses in this little container, and it's natural peppermint flavour. And as an added bonus, all the packaging is made from ocean plastic, so it's also environmentally friendly. And it's just one little pump into the mouth per day, and that's you good to go. As always, if you found the video helpful, then please share it with others who might benefit, or add in other friends or colleagues into my closed group, our Positive Perimenopause closed Facebook group. And again, all information here is intended as guidance only, not as a replacement for your own research or medical advice from your own doctor. So hope you have enjoyed our little vitamin D video today. And as I've mentioned, vitamin D and magnesium are the perimenopause and menopausal woman's best friend.